What's going on, guys? You're probably wondering why you're seeing me for a third time this week. Well, this might be the second time technically, but we're putting another video out on Saturday, so it'll be 3 times this week. So on October 11th, something was told about what was going on with me that completely changed everything about my life. And I haven't really put a lot of information out there about this just because I've been trying to deal with it myself. But with that being said, the question is what is it that I'm talking about? Well, I'm actually talking about functional neurological disorder, or better known as FND. Now, I'm not surprised if any of you out there haven't really heard about this or know that much about it. But around 7 months ago, I started to have these very strange symptoms. And I was concerned because both my mom and I have a maternal cousin that were diagnosed with dystonia. Now, here's what's strange. We thought it was dystonia at first, but because of how fast this has progressed, my neurologist believes that it's FND. So even though that both of these conditions are basically, well, sister disorders, there's a lot of stuff that's classified under FND. So what I'd like to do today is I'd like to, play a video for you guys from the Mayo Clinic. And this was done about 7 years ago, but it's probably it's a shorter video for one, and for two, it's pretty thorough for the most part. So part of this disorder, honestly, is they believe that part of it is psychological. They obviously can see, that the symptoms are going on. And if you guys are wondering kind of why I look out of it today and I'm slightly slurring my words and whatnot, it's actually because I had basically I have what's better known to the medical community as non-epileptic seizures. So I'm fully conscious. I'm fully aware of what's going on around me. I can even sometimes have conversations, not very good ones, obviously, but I can sometimes have conversations with people if they ask me basic questions. So it's a very strange feeling, feeling like you're losing control both of your brain function and your bodily function. So for the last 7 months, I feel like I've been essentially losing control of my body and my mind, slowly but surely. Now, before I say any more on that, I'd like to play this video first, and then we'll kind of talk about some of the things that's happened to me in this time. And I'm trying to bring more attention to this. FND, or functioning neurological disorder, is a very serious condition. And it affects so many different areas of life, it's not even funny. It's really not. And I'm making this video this week because I've had a lot of people ask, what this is. I've had, I had done on my personal Facebook account, did a rough explanation of what's been going on with me. And this still doesn't even fully describe everything. But let me get this video pulled up here, and we'll get going. All right, so this is with the this is actually talking more about the psychological side of stuff, but nevertheless, I think you guys will be able to kind of see where I'm coming from here. All right, so let's get into this video here.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
According to the National Institutes of Health, what was once called conversion disorder, but is now more commonly known, or maybe better known as functional neurological disorder, that's a condition in which you show psychological stress in physical ways. Your mind affects your body in unusual ways sometimes. Conversion disorder or functional neurological disorder can present as blindness, paralysis, or other nervous system symptoms that really can't be explained by a physical illness or an injury.
It's frightening. Symptoms may occur because of emotional distress or psychological conflict, and they usually begin suddenly after a stressful experience or traumatic event. Here to discuss conversion disorder, we need to stop calling it that. It's functional neurological disorder, and how it can be treated is Mayo Clinic psychiatrist Dr. Jeffrey Staub. Welcome to the program.
Thank you. Thanks for having me.
Okay, why did it have to get changed from conversion disorder to functional?
Well, there's really a couple of reasons, but the main one is because the idea of it always being related to a psychological stressor, which really dates from the time of Freud and others 100 years ago, isn't something that holds up all the time. People can develop functional changes after a medical event, and sometimes for reasons that we can't pin down. So we certainly look for people who have undergone difficulties either in their present life or past life, and sometimes find them connected. But other times we find a medical trigger, a fainting spell, or a medical illness, and sometimes we really can't sort out what triggered it.
So there's the common, there's the unusual, and there's the rare, but then there's the really curious and peculiar and maybe confounding, and this sounds like it's in that category.
Right. It's so all of us, that practically any doctor in practice right now is trained to think that when a patient presents with a symptom, whether it be a spell of passing out or a movement of the arm or a lack of movement of the arm, is that we look for neurological causes. We look to see if there's something wrong with their brains, their muscles, their nerves, and if we don't find anything, then we presume that it's psychological. The problem is that we can't always find the psychological, and so that's been a sort of an either-or way of thinking that hasn't always put us and our patients in the best spots. So as we go through evaluating people who present that way, we certainly look for the psychological things, but sometimes we don't find anything in particular, and neither do the neurologists, and neither does anybody else, but it's still a treatable condition, and that's the best part of this, is even though it's sometimes mysterious, we can do something about it.
So you've seen, I'm sure, in fact, we mentioned at the beginning that these people can have blindness, or they can have paralysis or other nervous system disorders or symptoms. So how do you go about evaluating somebody and end up putting them in this category of a functional neurological disorder?
Well, we have to work as a team, so we can't, as psychiatrists, do it alone, and we work together with our neurologists and sometimes bring in a general internist to help us as well. And so the first thing we do is listen to the story, listen to how this is developed and how it's changed over time, and sometimes that gives us the clues. The triggers are something that the patients and their families might have picked up, and if we give them some time to tell us about it, we can see that and look and then listen to the patterns. And then we do have to evaluate the parts of the nervous system that could be affected. So scanning of the brain and an EEG to look for seizures, laboratory tests to make sure there's not infections or other things like that. That's a part of the evaluation. And then from the psychiatric standpoint, a look at a person's past history, how they developed, recent things that may be going on in their life. We look for all of those clues to try and put the picture together. Last thing about this is it's not either or. There are patients who have both a stroke and a functional problem together, or epilepsy and functional spells together. And so that's another thing that we were all taught, was thinking in either or ways, and that fails a lot of patients who have one thing triggering another and then both exist together.
I can imagine for the patients this has to be incredibly frustrating and frightening.
Well, it is for a couple of reasons. One is that some of these symptoms are very dramatic. I mean, people can have completely lose consciousness. People can have what looks for all the world like an epileptic fit. People can have loss of memory that goes on for hours or days. And so they're very frightening symptoms. And and the way that they present, all of us think, well, this has to be something wrong with the brain. It can't possibly be something that comes from a psychological process, or can't be my mind doing this to me. And again, we can't always say that that's the case. But that and so as a result, a couple of things happen. Patients oftentimes get very extensive neurological evaluations for tough things, for strokes, for ALS, for problems, for MS, for multiple sclerosis, problems like that, which are very, very frightening to go through an evaluation where somebody thinks that that's maybe going on. And then when they kind of get to the end of the road and their doctors are not left with answers, then they're starting to say, well, this has to be something going on with you. And that's when it's very difficult to shift gears.
So what do you do?
Well,
what do you do to help these patients?
Right. So there's a couple of things. First of all, if we do happen to find something that's gone on in the person's life, then we have to address that. I've encountered many patients who have a sudden event occur. Everything from a woman who became paralyzed after an earthquake because she was overwhelmingly frightened that something bad had happened to her family, to people who go through stressful times in their life. So we look for those, and if that's present, we can address those. If we can't find a specific cause there are a number of different behavioral strategies that we can use. Our physical therapists work closely with us. So if somebody's having paralysis problems or abnormal movements or walking difficulties, the physical therapist can rehabilitate them using techniques that they've been taught for over many, many years.
So tell us about one of the most unusual cases that you've seen with the unusual presentation.
Sure. One that I use to teach patients about this is when I was in the Navy. I was stationed in Guam, and we had an earthquake, an 8.2 magnitude earthquake, so pretty big. And it was a woman who was apart from her family at the time. She was visiting in another village, and she was brought to the emergency room about a half an hour after the earthquake, deaf, dumb, blind, mute, and lame.
No.
Yes, absolutely nothing. And so, of course, we wondered if she'd been injured because she was by herself, and she hadn't been. Medically, neurologically, she was perfectly fine. And in that particular case, what had happened was she became, at the time of the earthquake, became so overwhelmingly frightened that her sons, daughters, or grandchildren had been injured that literally her body shut her down. The old sort of see no evil, hear no evil, walk to no evil, experience no evil is what happened with her. And when one of her family members came to the hospital to find her and said that, the house is a mess, but everybody's okay, we could give her that information and kind of help to coax her back to walking again and then seeing again. And in an hour and a half, she was able to leave the hospital perfectly fine. So that's an example of how intensely overwhelming sudden fear can be. But we've also seen circumstances in which, just as dramatically, people have things like headaches, a migraine headache that produces some change in vision or some change in movement that we know migraines can do, but then goes and gets elaborated into a much bigger picture. And there, treating the headaches is the solution.
So most of these resolve spontaneously. And what's your role as a psychiatrist in helping the patient get better?
Well, some of them resolve spontaneously. So sometimes people have distinct spells and they go on for a while and then go away. But left untreated, some functional disorders can continue for years and years.
Really?
So if somebody's getting better, and we can help them understand what happened and continue the process of recovery, we don't have a lot to do. But if they're not getting better, then we do have to sometimes work together, again, with neurology, physical therapy, and our team of therapists to address all the pieces that might be part of the picture.
Well, you have a truly interesting job, don't you?
It's fun.
How often do you see one of these people?
We
like
see about 3 to 4 a day.
Every day?
My team, yes.
With functional neurological disorder.
So movement problems, persistent dizziness or vertigo spells, fainting or other similar spells. Yeah, our team has specialized in this type of a problem over the last few years.
Well, certainly some of things in medicine are difficult to explain and very unusual. And some of the people that you see, some of the most unusual things we've heard about on this program. Dr. Jeffrey Staub, psychiatrist at the Mayo Clinic, talking about functional neurological disorders. Thanks so much for being with us.
Well, it's been a pleasure. You're quite welcome. Glad I could be here.
Sorry about that, guys. I forgot that I had muted my microphone, but so I hope that was a bit helpful. There is possibly one other video that I can actually show related to this. Yeah, I think I'll go ahead and do that. So there's a couple more videos that one of which isn't too long, so I'll probably share what I can from that. But I also want to talk about these symptoms. So obviously that was from the Mayo Clinic, and the article that I was actually looking over is also from the Mayo Clinic. But there is a lot of risks. There is a lot of different things that can potentially happen. One of the things that, one of the complications is obviously pain, anxiety, depression, insomnia, and fatigue. And any given day, I struggle with pretty much all 5 of those. Maybe not in not in the same way. I would say every day. But the part that's frustrating is how, I was asked. I'll just kind of say it this way. So I was asked during the doctor's visit on the 11th to do basically kind of like the examination, which is a series of like hand to nose and touch the finger kind of thing, walking down, putting my feet in a couple of different positions. And it had been about 3 months or so since I had last seen my neurologist, and her assistant, obviously her assistant didn't really know much of what was going on other than what was in the files, but my doctor, was kind of a bit put back, I think, to a degree, because my conditions have gotten extremely worse since then. Now, one of the things that I was asked, and I openly answered, is, have I had trauma? And I was like, well, yeah. And, so I talked about, Lydia being in the hospital 3 times last year, and 2 out of those times I almost watched her die. And I don't know if that's what contributed to this or not. I don't know if it was the stress of the job that I had at the time, which is being a forklift operator. And that was I work well under pressure, and like it takes a while to figure out your job when you do a job like that, especially for the company that I work for, because they wanted everything right now, and it just isn't possible, even for 3 to 4 forklift drivers for that side of the facility. It just, there was a lot of stress, and they would basically, essentially, like, I would hear one person say something, and then like 2 seconds later hear the second person say the same thing, and so on and so on and so on. So there were a lot of days where it was stressful, but I don't know, like I don't fully understand this as far as like how involved my past is with this, or the things that I've done. I'm actually an open book with pretty much anybody that I feel like I can open up to, which there is a select few people that I definitely can do that with, but it's some of the stuff that I've been through. A lot of people don't just, they're in awe in a certain sense of what I've been through in my life. But again, like, yeah, the causes, they don't fully understand. And I'll be honest, like, even if they do find the underlying cause with me, if I'm able to actually afford to go to a counselor or a therapist, which is extremely expensive for those of you that don't know, even if they're able to pin it down, that doesn't mean I'm ever going to be normal again. Doctors, I think, give you hope, in a sense that they can kind of put you in the right direction, but nothing is a guarantee. So this condition has been very, very scary for both Lydia and myself. And like, there is funny moments, like, I know when some of my good friends, kind of start picking on me, and like, I make fun of myself a lot. That's the only way that I can cope with my condition, is to laugh at myself. Because some things are just generally funny, like with my hand doing this number and all that all the time, it's hard to, like, eat with a fork. Because like the food falls off the fork and I pick it back up and it falls back off again. Lydia picks on me about that a little bit, but it also is like, they don't fully understand like how frustrated I am with myself in that situation. That I laugh about it, it's still frustrating. So yeah, I mean, this is definitely not an easy thing for us to go through. This is not something that we were expecting whatsoever, and again, like, we're just learning about this, and the most frustrating part is that doctors don't fully know why it's happening. They can make hypotheses, like that doctor did. The difference between, I think, this other video that we're going to be looking at is, I believe that she is, I'm not sure if she's a doctor or not. Oh, it's from a rehab center. Let's see here. You know what? I'm going to play this other one because this is coming from, I think, a neurologist. So I'm trying to give you guys enough info here to kind of understand that, like, this is not something that's easy to deal with. I'm very much struggling, daily. And as I said, I can't even remember if I said it or not, but the toll that it's playing on me mentally is extremely challenging. I don't have, there's so much of a disconnect there, when it comes to, like, if Lydia asks me a question, she can literally ask it, and 5 minutes later, I have no idea what she's talking about. And it's not as if I'm forgetting that she's having a conversation. It's because, like, there literally is a disconnect in my brain. So, coming from my point of view, right, even that I'm showing so many of these different symptoms, it doesn't account for, some of the emotions that you have. I'm frustrated a lot, guys. I'm not going to say that I get angry, because if there's anybody that I need to get angry at, it's myself. The hardest part about this, guys, and I'll be real about it, is knowing the burden that I put on my family. And I sincerely mean that. Lydia would never say that. She'd never say that I'm a burden, but I haven't been able to find like a day job, and so I'm in the process of starting a new career in a completely different field. Maybe one of these days we'll talk about more of what we're trying to do. But I'm not really going to talk too much about that right now. But yeah. So in a nutshell, this is what I'm dealing with, is FND, and it's hard to even understand it completely because, again, they essentially don't really have answers. They do, but they don't. But I also don't think it's entirely fair for a psychologist to kind of make those presuppositions. I feel as though what people do, like, if you're going through this, definitely go to a neurologist before that, and see if it's not some of those things. Because I've had the EG test. I've had a urinalysis test of another disease. Both of those came back negative. I've had like 3 or 4 other tests so far, and all of them have came back negative to this point. Like I said, there's only 2 more tests that I can do. So, yeah. I'm not sure what else to say about it, other than the fact that, you know, I'm trying to show you guys, you know, like, this is what it's like. And not a day goes by that, you know, some of this stuff isn't my concern.
He is not a burden.
I knew she was going to come over and say that.
Because you're not. He's really not. He's my strong, handsome husband. Who I've loved since the moment I saw him.
So do you think I should... Guys, let me take a drink of water so you guys can, like, not suffer through my voice right now. Hang on. Okay. Do you think I should play another video?
I think that video did it good.
Okay. Well, I was thinking about playing another video related to FMD. But I'll be honest, there's only really like a few videos on this particular topic, and most of them are, you know, trying to explain it from a medical standpoint, but they're all pretty much going to say the same thing. But those of you that have been, you know, wondering like what happened or like, you know, what this led up to, all the way back in late May, I'll just kind of give you guys the rough story real quick as to like what's happened since and how it's evolved. So it was late May, and it was a Sunday afternoon. I think it was a Sunday afternoon. I can't remember exactly what day it was, but it was a very weird day. So Lydia was just doing something in the kitchen. I don't remember what she was doing. She doesn't even remember what she was doing. I think she was just like putting away dishes. And I had told her, I was like, I feel really, really sick right now. And she's like, in what way? And I was like, I literally feel like everything that you're doing, every sound that you're making is reverberating inside of my head. And so it was a really weird behavior that she had seen from me, because I didn't go to the bedroom. I went into the office, this room that you guys are seeing right now. And, well, I literally curled under my desk and fell asleep. And when I woke up, I actually kind of forgot how I got there. And that was enough for Lydia to say, all right, we're taking you to the hospital. I want to make sure that you're okay. And of course, you know, I was in the hospital for about basically overnight. They checked me for seizures and a stroke, and both came back negative. So they basically said, okay, well, we don't. So this is very strange. I'm not going to call out the hospital because I don't feel like that's fair. But I will say, I think most people expect there to be a neurologist on staff. The local hospital here in Clarksville, if you guys know, you know, they don't have a neurologist. So I'm talking to a doctor literally through a screen from God only knows where. And it was just really awkward, and they basically gave me some meds and told me to go home, and if it happens again, to go to Vanderbilt, which is in, for those of you that don't know, that's in Nashville. And so it happened again. It actually was worse the second time. It was only a few days later, and I think it was a Sunday again, actually. Don't ask me why that happened twice on Sundays. That part I don't really understand or know. But within 30 minutes, I was talking to a neurologist, and luckily within that week, they were able to, and now this goes into the first week of June. Luckily, they were able to have a opening available for my neurologist that I have now. And it was going to be like a several month wait, but we basically explained, look, this can't be several months, like this is serious, we're both scared. And so they managed to get me scheduled with a neurologist. I've seen her 3 times. Now, the first 2 times it wasn't as bad. It was getting worse, I would say, by the second visit. Definitely not as bad, though, as what she saw on the 11th of this month. Now, that leads me up to, the movements that I have. Well, the movements that I have, essentially, like I've said, they look like tremors at first, like that's how it kind of comes about, like kind of what my head's doing now, and my hands I keep showing you. Yeah, those are tremors, okay? And then those tremors kind of start getting worse and eventually turn into basically a non-epileptic seizure. And I really don't entirely know what's going on. I mean, I'm aware of my surroundings, but I don't really know what's going on in those moments. And it completely drains me. So that leads me up to why I'm sounding the way that I am, because that did happen to me a few hours ago. But with all that being said, I really just wanted to put this video out today because I want people to understand that, look, this is, even though that I know God can do miracles, and I know the Lord is capable of healing me, but I have to be real with myself too, that this may be permanent. I'm 95% sure at this point that my face, with like what's happened, with the droopy mouth, the eye, this eye's a little bit more squinted to this one now. I'm fairly certain the face is going to be permanent at this point. But as far as me getting any further treatments, we don't know. We just don't know. We need to see how this develops over the course of time. It's been frustrating because I'll be honest, nobody can really do anything. And even if I were to go see a psychologist or a counselor or something, they would have to be open-minded enough to hear my testimony, because it's not unique. I'll say that. It's not a unique testimony whatsoever, because the only reason why it's unique is because it's the United States of America. I'll just say that. But yeah, there has been trauma throughout my life. Now, it hasn't been anything. The trauma is for a different reason than what you may think. Yeah, I know that this has been kind of an impromptu video. I'm not really doing much editing on it or anything like that. I just kind of wanted to come on here and explain to the people that we have that are subscribed, the people out there that are loved ones and friends and people that we consider family. This is me trying to give you the most information that I can give you right now pertaining to my condition. We don't know a lot. Doctor doesn't really know a lot as far as why it happened, when it happened. like I said, I mean, I'm sure there was some contributing factors, but for my head to be doing what it was doing, early on, it was just kind of pulling down to the right, kind of like that, and I would straighten up and I was pulled down again. Within literally a couple of weeks, like me starting to have actual spasms, which eventually led at that point into these seizure-like spasms that I have. It's progressed very, very quickly, and I've talked to several people that I truly care about this situation. And one of my homeboys, my brother from another mother, he heard me out a couple weeks ago, and he was like, "Dude, I'm coming from the same angle that you are. Like, you do actually wear your heart on your sleeve. You do talk about your life. You do talk about your struggles." He goes, "So I don't see how it could be necessarily a psychological issue. I mean, it still could be. Don't get me wrong. But again, it's one of those that, like, I don't understand it, and I don't know if Lydia understands it. Lydia has been kind of my rock through this, mainly because, as soon as we got the diagnosis, the first thing that she did is start researching it. and then reached out to a person actually that shares a story on Instagram of the same. She's got the same, basically the same types of stuff that happens to her. Hers has gotten to the point where she cannot walk though. So Lydia has reached out to her, to see kind of like, what she's experienced, and it's basically been the same thing as me. As far as going to doctors and people trying to figure out her condition, it's honestly, I really feel like it's going to be a needle in the haystack to try to figure out, why it's happening. That's why I don't ask why. I just accept the fact that it's happened and move on, and try to make the best of the situation. But again, the last thing I just want to focus on before, we part ways in this video is I want to try to explain the mental toll a little bit. I had mentioned that earlier, but I want to explore that thought a little bit more. When it comes to the mental side of stuff, it's really challenging. See, I get so frustrated sometimes because I can't say what I'm thinking. There's this disconnect that happens. But I'll say this. When you're talking about depression and anxiety and all this stuff, yes, that does play a factor. It does for sure. But it's also like this, the feeling like you're losing control. So if you stack that together, this feeling of kind of like you don't feel like you have control over your body, and then also pairing that with, the other things that were mentioned here as far as the symptoms and also the complications, which is pain, anxiety, depression, insomnia, and fatigue. I literally, like I said earlier, have each one of those, and it can be really, really challenging from day to day. Like there's days that I can't get out of bed. Like I really, really struggle to get out of bed. And Lydia's gotten to a point to where she's like, you know what? If he's asleep, just leave him. I'll try to get up when I can, but these spasms even happen when I'm sleeping. Lydia told me kind of a funny thing the other day. She was like, I know that you were asleep, but something kind of funny happened. I was like, what's that? She goes, well, I thought you were like trying to cuddle me for a second, because you're when you lay on your stomach, you're right, like it's kind of doing all these funny things. And so I thought you were initially playing footsie with me. And then I realized that you were just having a spasm. I mean, like, yeah, it can be funny. But I just want to say that, this condition is concerning. It's very, it's not an easy condition. And I'm sure you guys maybe want to hear Lydia's perspective on this. So I'll see if she can come over here for just a second, and try to explain her side of the story here a little bit. You got a minute over there?
What you need, honey?
You want to come over here and explain your side of the story to all of this?
Sure, hold on. Trying to decide on where I want to get your subs.
I swear she's a foodie, but she'll never admit it. Like every single time we have a conversation, 90% of the time it's about food. That's why I'm a bigger guy.
What you need, honey?
So I want you to just kind of explain like what you've had to go through since all of this happened for the last 7 months, and like how you're dealing with it.
I'm dealing with it because God is sovereign and Jesus is king, and that is literally how I get through my day. Like I told Brent earlier today, when I was in the hospital last year and they had to test my CO2, I was in a lot of pain from that, but then they had to draw blood from a certain area that was very painful. And he looked me straight in the eye and he told me, what do I always say, Lydia? And I'm like, God is sovereign, Jesus is king. Now I want you to quote Psalm 23. And he goes, quote it, say it out loud. He made me say it out loud. And that's what I'm telling him today. Say it out loud. You can do it. And just remember that. Okay?
I hear you.
He's not a burden. It's a lot of paperwork, and I'm afraid that I'm going to not check the right boxes. But other than that, I'm not stressed out because God always provides. He always takes care of his children. As I've told Brent before, if God makes a bug's butt light up, how much more will he care for people that are crafted into His goodwill and who's created in His image. That's literally how I get through my days.
Well, it necessarily wasn't talking about that. I'm talking about, like, you know, what you've seen and
Oh, well,
experienced. That's kind of what I was getting. I appreciate what you just said, but
that's what I thought you meant was like.
that's fine. But can you explain, like, your role that you've had to play for the last 7 months?
Basically, I have to be His caretaker. I handle 90% of the chores. I've always done the finances, always made sure the bills are paid. But now I have to do paperwork. I sometimes have to help them get dressed. I sometimes have
I
to
have a
help
hard
them
time
stand.
buttoning my shirts. That's
sometimes-
that's mainly what she has to help me with.
Yeah, I sometimes
For
have
now,
to help
anyway.
them get up. I've had to adjust how I make food because his hands are shaky. So I'm trying to make more sandwiches or wraps, something that he can hold easier.
No lie, it is that frustrating some days.
Make sure he takes his pills and his medicine. Make sure he has copious amounts of water. A friend of ours said that maybe metals, like metal toxins from even the local tap water, which is still pretty good, may cause some issues. So she was very kind of us and bought us a Brita water filter. So to go in our sink. So just little adjustments like that, you know, and having to realize, okay, well, he can't go out for too long, you know, so we try
Everything
to go,
has to be planned out, guys. No
so
joke.
we don't leave the house much, which is fine. I don't really well, I mean, no much.
It does bother me because I always want to try to explore. I mean, like, that's part of what we do on this channel, right? Is we try to go find places that you guys want to see. But
That it?
yeah, can be. Awkward silence.
I wish it was a gum. I don't know too.
Anyway, guys, yeah. So Lydia's.
I hope that helps.
I think it does, just to bring context. So, you know, as you guys just heard, you know, like, Lydia's had to do a lot of stuff for me.
I don't mind. You know that.
I know she doesn't mind. She's literally dancing off screen right now. All you can see is her arm.
I'm perpetually happy-go-lucky. You know this.
But yeah, to say that our lives haven't changed is a complete understatement. You know, like, dealing with Lydia's oxygen machine is by far way easier than. Okay, so I think I've mentioned this before, but I do the claw machines. You know, at any given place. And the little Smurf guy that you just saw was one that I won a few days ago for Lydia. But anyways, I hope this has been helpful for those of you that are trying to kind of understand, you know, what's been all involved in the past several months, and also, you know, what's been going on with me. As you can tell, you know, this is a very serious condition. Like, this is not something to. Well, I'm gonna say it this way. It's not something to mess around with, but simultaneously, you kind of have to expect the unexpected with this. Like another aspect, right? She was just mentioning something. It's very hard for me to go into any store because just people and overstimulation is actually a part of this. This is something that can make this whole situation way worse. It's happened a couple of different times, one of which I think I shared in one of our video, like our earlier videos. But at least we have a diagnosis now. It still doesn't really change much as far as what I've been going through. And probably longevity wise probably won't make a huge difference. You know, I do have hope and faith that the Lord can, you know, heal me from this. You know, if there actually is an underlying condition, there may not be. But, you know, I just wanted to cut this video today, mainly because, you know, I wanted you guys to understand more of what's been going on and why. You know, if you've been listening to podcasts, you know, you can hear my voice change, and it doesn't sound the same in every episode. It kind of sounds different in each episode, but that's okay. You know, this career that I'm trying to get into now, it'll be amazing. Let's put it that way. It's definitely right up my alley. Anybody that I've talked to about what my next move is are pretty excited about it, but you know, that doesn't mean that it's easy to get into. So with all that being said, guys, I'm not gonna talk to you too much longer because we've been at this for about 45 minutes. So till next time, see you guys later.